So when you go to the vet, you're always wondering, what's the veterinarian doing? Touching my cat, and are they doing anything, or are they just massaging? Well, Dr. Miller's going to show you that she is actually doing something. She's doing a physical exam, and there's a lot of things that she can learn from that physical exam just by touching. So, Dr. Miller, take it away.
All right.
Mrs. Willis.
Yep. This is our volunteer Willis today. Willis is an Abyssinian cat. By their very nature, they're leaner cats in general. And so one of the things that I'll examine when I first look at a cat is what kind of body condition they're in. If they're thin, they're overweight, they're obese, or if they're ideal for their particular size of frame. And Willis is actually ideal for an Abyssinian cat. The other thing too is I'll check his mentation. How alert is he with things that are going on around him? Is he paying attention? Can he see? Can he hear? How coordinated is he in his movements? And so we can evaluate all of that just by watching him on the table here. And then we'll take a little closer look here at Willis. And I usually start with the head. And we're going to just get his little face up this way a little bit. Take a look at his eyes. Looking for any inflammation, discharge. We're going to take a look at his nose. We're going to take a look at his teeth. Looking for tartar, swelling of the gums, gingivitis, any masses or oral lesions, ulcers, things like that that you can find in the mouth. I'm going to feel his lymph nodes. I'm going to take a quick look in his ears. If Willis was an older cat, we'd be checking his thyroid gland. Willis isn't too old, but the thyroid gland lives in the neck. We're going to feel if that's enlarged, and it's not. I know there's a light there, isn't there, kiddo? All right, let's take a peek. Oh, it tickles. It tickles. Good boy. Taking a look down at the eardrums and the ear canal, looking for any inflammation or debris that might be in there. Willis's ears are nice and clear. We're going to use the ophthalmoscope to take a closer look at his eyes. We're going to see if they respond to light normally, as they should. And he does. And make it not so bright for him. And take a look deeper in the eyes at the retina and the lens and the conjunctiva. Good boy. And he appears normal. While we're working on the head, we're going to get his temperature. At the cat doctor, we use an ear thermometer, which is a little less invasive. Very good, and that's normal. We also need to get Willis's weight today, so we can compare that to his previous visit. All right, come up here, darling. He's 7 pounds, 3 ounces. There we go. Back over. Good boy. I'm checking his lymph nodes again. Checking for any lumps or bumps along his body. Come back here, darling. Still checking for any lumps or bumps. Checking his lymph nodes in his back legs and his groin. We're going to just comb him for fleas, also to look for dandruff or any other parasites that he may have. He looks good. I know you're a good boy. All right, we're going to check his joints here as well. And check his paws and his toenails. Make sure that there are no injuries or ingrown toenails. Very good. I'm going to come back here and we're going to check his knees and hips. Good job. And we're going to check these back paws. And he looks good. I'm going to take a feel of his belly. We're going to feel for any hernias or masses. Also, we're going to check the liver, the stomach, and the kidneys. We're going to feel the intestines. Work our way back down to the bladder as well. Yeah, feels good, handsome boy. All right, we're going to take a listen to his heart and his lungs, listening for any abnormal rhythms of the heart, murmurs. Mr. Willis is purring quite loudly. It's a little challenging to hear the heart. Make him stop purring for just a second. Good job. And his heart and lungs sound good. So that concludes our physical exam for Willis.